This is Dr. Daniel Paul with Easy Orthopedics, and today I'm going to talk about when you should go to an orthopedic urgent care. So there used to only be emergency departments. If you got hurt, you had to go to the ER. And, for some things it's great, like you're having a heart attack or a stroke or, your leg's broken. But a lot of people were tired of going to the ER and didn't like the wait. And so what happened over the past 10, 15 years is something called urgent care sprang up, where you've probably been to them where you can go for a cough or a cold. You don't have to wait too long. It's almost like going to your primary care doctor's office, just slightly different. And recently, actually, what's sprang up even more recently are orthopedic urgent cares. So now these are urgent cares run by orthopedic practices, basically saying like, hey, come see us for all your orthopedic issues. So the questions are which one should you go to? When should you go to an ER versus an urgent care versus an orthopedic urgent care? So I'll say this. If you think you're going to die or you can't walk or your bones or it looks grossly deformed, go to the emergency room. The urgent care, regular urgent care is going to send you there, and so will the orthopedic urgent care. So if it's really bad, and usually if it's really bad, that's where you want to go. And certainly for any medical things, like if you think you're having a stroke or something really concerning, then I would recommend going to the ER. Because like I said, if you go to the urgent care, they're just going to send you to the ER. For a regular urgent care, they're pretty good at like coughs, colds, pink eye, that sort of thing. They do some orthopedic stuff, but you got to remember you're not being seen by an orthopedic specialist or usually someone that knows a lot about orthopedics. So any sort of musculoskeletal thing, whether it be your back, shoulder, elbow, hand, wrist, knee, ankle, anything like that, that's usually not the best place to go for for a regular urgent care. What they will do is they'll take x-rays and they can tell you if it's broken, and then they'll probably give you a splint or some sort of brace. They charge for these splints or braces. So usually you can't get out of there with getting some sort of splint or brace. Most of the time it's indicated, sometimes it's not. These are money-making operations when it comes down to it. So that's the game they unfortunately play. But I have seen it where someone goes to an urgent care and they say, hey, everything's fine. And then you find out they've got some terrible fracture that they didn't diagnose. Or they say, hey, this needs surgery when it doesn't. So, if it's a real orthopedic issue, you're going to get better care at an orthopedic urgent care. Which brings us to the question of when should you go to an orthopedic urgent care? If you have any sort of musculoskeletal issue and there's an orthopedic urgent care open and available to you, you will get better care if you go to one. You may not see the doctor, you may see a PA, but these are orthopedic PAs that work with the doctors, and they're built for only orthopedic stuff. So if you're able to walk in there, you'll probably be okay going. And also, if you do have something like, let's say a bad ankle fracture that needs surgery and you hobble in there, they're going to be able to book you and get you ready for surgery. That's not going to happen with a regular urgent care. With an emergency department, it will, but everything is much more streamlined. So for any of those issues, I think it makes sense. The disadvantages are, there's not as many orthopedic urgent cares. I run one myself, or I do that sort of care. So there's not as many and they're not open as often, so they can be harder to come by. But if you can go to one and it is like a, arm, leg, back or neck issue, and it's nothing, and it's not crazy, or you still feel like you're able to walk and move around, then it may be a good bet. But they are new and they are evolving. So I hope I was able to answer your question about when you should go to an ER versus an urgent care versus an orthopedic urgent care. If you have any questions, please leave them in the comments below and I'll do my best to respond. If you like our content, we put out new videos every week, so please like and subscribe, and thanks for watching.